Hello and welcome back. Dr. Rich Castellano here, ImageLift, double board certified facial plastic and reconstructive surgeon. In this video, we're going to talk about under eye circles, eye bags, dark circles, hollows, whatever you want to call them. There's many ways to treat them, and we like to do it the safest way possible, non-surgically. So let me demonstrate, and I want you to see some before and after pictures. So what I'm going to do is I'm going to share my screen, and here we go. So now we should be sharing screen. Now I want you to look at this patient under the eyes. You see this under eye area. A lot of people would offer her surgery, and you may be able to get a good result with surgery, but for this patient, I did Sculptra under the eyes. Time out. When you go onto the internet and you read up on the internet, and of course, everything is validated and fact-checked on the internet, you're going to read people say, oh, don't put fillers here. Don't put Sculptra here. We do it there every day. If you're not comfortable with it, I recommend do not do it because you need an expert, someone who knows the surgical anatomy. Beginners and intermediate level injectors should not be putting fillers here. I completely agree with that, but we do it. I even do it on myself, and I'll show you in pictures. This is a patient where we did the filler under her eyes, but I want you to take a look here and just see from every angle. This patient, I actually injected her, and I tell my patients, I'm like, look, if you want surgery, you can go get surgery, but I recommend let's do some filler and volume, and if you're happy, great. And if you want more, then I can send you somewhere who can take care of it. I can do the surgery myself. But as we age, we're going to lose volume. So you want to preserve that volume. This patient, we preserved the volume. I injected her. I saw her back about a year later, and I said, hey, how's it going? I haven't seen you in a while. I said, how's that Sculptra doing for you? Her response was, I guess it's okay. We looked at her pictures, and I was like, oh, can we share your picture? This is fantastic. This is better than a surgical result. Gives the volume back, lasts for many years. Of course, aging keeps coming, but if we can prevent you from having surgery, we did you a favor. You don't want the risk. The lid can droop from lower eyelid surgery. Stay away from surgery if you can avoid it and still get amazing results. Look at this. I've shown this before, but this is the face diagram, face continuity plan. And these circles are where we inject. And right here under the eye, temple, and brow is where I'm focusing. Now, I want you to see here. Here we trimmed a little bit of eyelid skin on the top for this patient, and we did Sculptra under the eyes. And look at the difference. Doesn't make it perfect, does make it look better. By the way, if you actually make something look perfect, it looks a little weird or funky, sometimes extreme or severe. You don't want people looking at you funny. You want to look natural. They give you the look, right? So look under the eyes. Look at the difference here. Under the eyes, we also trimmed the eyelid skin. Looks good from many angles. Natural, not overdone. This is a patient pretty deep eye bags. What people would say is a classic example of who can benefit from surgery, removing the fatty pockets. Think of it like mountains and valleys. There's the mountain of the eye bag or the eye pillow. There's the valley in front. Let's just fill the valleys. Now, for her, this is one session. I would recommend for her sometimes second or third session, but she got a nice improvement. She's happy. We have patients with all different skin complexions can benefit from this treatment and avoid eyelid surgery. We've shown these pictures before, but this is a subtle result. Our younger patients, they don't want to wait for advanced aging changes, so we do the filler to build those areas up. Again, these are the areas we can fill, but right now we're focusing under the eyes, lower eye filler. And these are my pictures, which I do the lower eyelid filler in combination with the temple and the brow. And you can watch my videos on Facebook. There I inject myself. I love my technique, and I like the way I know where I want to put it. This is a patient combination treatment, combination of lower eyelids, full face, the shape of the face. This goes very well with full face correction. So some of these pictures you may have seen before, but it's worth emphasizing when you're looking at under the eyes. Look at the improvement here. Many people would say, it looks like she had lower eyelid surgery, but she didn't. How awesome is that you can get a surgical result non-surgically? Look at this. And now she did do some laser resurfacing, and filling up those areas is far superior to getting cut under the eyes, risking the drooping, risking problems, surgery under the eyes. I don't recommend it. Do the fillers and look at what a great result you can achieve. If you do the fillers and you still want surgery afterwards, you can do it. Oftentimes when you build up this lower shelf, we call it a negative vector when the orbital rim is really set back and the anterior aspect of the cornea is more forward. When you build that up, I believe it helps to prevent the droopy lid because you have more substance here to bolster it. So take a look. Now, Maddie's a great example. Looks so natural, not overdone, but look how hollow she is under the eyes. And if we can get this type of result for you, everybody's different, of course. You're going to be so thrilled. No surgery under the eyes. She did do a lift. She did do the laser resurfacing. And of course, this gentleman did full face fillers. Look at how it improves under the eyes. We don't make it perfect. We make it better. And you look natural. 100% is guaranteed. So this was our little tutorial on lower eyelid fillers. When you have the right provider, the right expert, we do it here all the time under the eyes. It's safe. We use the cannula, get you a safe experience. The cannula makes it as safe as possible. And we've had an excellent level of success with our patients. We'll keep you safe. And you want to keep that cannula, you got to keep it out of the blood vessels. You don't want to cause scarring, changes in vision, loss of vision, damage to surrounding structures. Come to the experts to get your treatments done. And if you have those hollows, we can absolutely help you. I'll see you in the next video. Give us a call.